Hi there. My name is Audrey Workman, and I am here today to kick off a short video series where I will interview administrative fellows from healthcare organizations across the country to talk about their experiences during the COVID-19 pandemic. If you aren't familiar already, administrative fellows are recent graduates from healthcare administration graduate programs who get to work very closely with senior leaders. They have a very unique perspective on healthcare organizations' responses to COVID-19, and I wanted to really just highlight the work that they're doing. So thank you for watching today. I have here one of my former classmates, Travis Marker. He is calling in from Geisinger Health System in Pennsylvania. And we're going to learn a little bit more about his experiences from his fellowship as he has worked there for the past year, and learn a little bit more about how his role and his fellowship has been impacted, especially by COVID-19. So Travis, thanks for joining on today. We'd like to learn just a little bit more about the basic structure of your fellowship and maybe like what setting that you work in. Are you on the hospital side or health plan side? Could you speak a little bit more?
Yeah, definitely. And thanks so much for doing this, Audrey. I think this is a wonderful way for us to promote the value of fellowships. And I hope some of the insights that I share can help folks understand the value of fellowship and some of the great health systems that we have across the country. So the Geisinger Administrative Fellowship is a 2-year program. It's not rotational based. It's very free flowing. There's a lot of self-directed projects and interim opportunities that arise. I started out as a fellow concentrated in the health plan for my first 9 months, but over time have kind of transitioned into a sort of hybrid role between the health plan and the clinical enterprise, as we call it. So we have several hospitals and a large clinical presence throughout Pennsylvania.
So did you anticipate that shift, or has that kind of come on because of our current pandemic?
So a little of both. I think coming into the fellowship, if you would have asked me 2 years ago if I was thinking a health plan fellowship for a start, I would have told you were crazy, that I would never go down that road. But I saw a lot of value in understanding that side of healthcare. So that's why I wanted to start there, but I always have kind of seen myself ultimately probably gravitating back towards more of the healthcare delivery side of things. I just didn't know that it would happen in the time frame that it has. So I still have plenty of health plan work going on, but there's been some shifts with preceptors and some organizational structure thing that has kind of opened up different opportunities. And then COVID has opened a host of opportunities to learn and grow and really help support a lot of our enterprise functions during this time. So there's been a lot of work on that shifted me over.
Yeah, these are certainly challenging times, and I'm sure a lot of what you're working on is not something you pictured yourself doing a year ago.
Right.
What are some things that you are working on to help your healthcare organization respond to COVID-19?
Right. So I think Geisinger has done a really good job at trying to be proactive. And one of those ways that we've been proactive is setting up screening stations for any patients, visitors, vendors that need to come into our facilities. We've tried to take a standardized approach, but when you stand things up as quickly as they needed to be stood up, as in the case of COVID, there's been obviously a lot of operational needs and help areas to help in. So our largest kind of ambulatory clinic setting, we needed some help and support to stand up some of the screening stations and manage them. So we have around 12 FTEs that are staffed to run the screening stations here at this building where I've been spending a lot of my time. So especially in the beginning, it was a lot of work trying to dispel fears and concerns among that team and helping get the process worked out as we standardize with the rest of the system. So still upkeeping some manage of that, but that was the first kind of pivot point that led me into a host of other things. But there's been a nursing home collaborative strategy that we have. So I've worked with developing surveys and reaching out to different nursing homes to have a report that's ultimately gone on to our state Department of Health. And that's helped coordinate some efforts that we have as part of a statewide coalition to offer education and assistance and to better collaborate our efforts with the nursing home. So that's been an interesting effort to be a part of. And there's been different problems that we've seen arise throughout this that have led to other projects. So another one I'll mention is a discharge transportation strategy. So especially up in our more densely populated areas, there's a lot of patients that rely on public transportation and other needs to be able to get where they need to go post-discharge. So we realized kind of early on that that was going to be a potential concern. So I was able to work with a lot of different great people and stand up our own kind of transportations.
Wow.
And, we've served dozens of patients weekly probably by now to help get them where they need to go afterwards. And it's also been a good effort for redeployment purposes for our employees because some of those drivers and other folks, from employee health and other areas, they've been able to participate in this and still have work to do. So that was a very rewarding effort to be a part of, and it was slow in the startup, but we've now started to see more volumes. And then just a couple other things. There's been a surge planning task force that we have for the central region, so I've been able to be a member of that group, which is led from a couple of fantastic physicians and many other great leaders through facilities, nursing operations. And one of those physicians even has experience in casualty planning for Hurricane Katrina and was down there during that. So it's been interesting to see some differences between those types of plannings and to see us plan through, potential moderate, severe, or even a limited, hopefully a limited surge that we see from COVID. Yeah, those are some of the things that I've been working on, including telehealth and helping build some of those things up. So it's a little bit of this and a little bit of that, and it's been very flexible and providing my resources where it's needed.
You really are getting a taste of all sorts of different things. That's a vast array of different project work, and it's great to hear some of those things, and especially the community partnerships stand out to me. It's great to see all these different entities coming together to make the health of our community a priority. So I am curious as well with the work that you've been doing to help your system respond. What are some of the key takeaways that you've that have stuck with you? What are some key learnings for you that you think will really make an impact on you?
Yeah, so I think, I have the belief that leadership is defined in moments of crisis. And I think that's been reinforced during this time. It's been really interesting to see, who walks the walk and doesn't just talk the talk. From a fellow and being able to learn and see who's really effective as a leader during this time. And I think there's been a lot more, there's been more people getting done things through influential leadership than formal or organizational leadership, like titles or whatever that might be. And I think that's, partially reflected in our CEO and the direction that he wants Geisinger to go, but it's been accelerated through this process. That influential leadership really shine through, and for people to use their relationship management skills to help bring teams together and dispel fears and get things done very, very quickly, much more so than we would have in a non-COVID.
Yeah, so those relationships have really been key too in making those needed changes.
Definitely.
I love that. Yeah, I've noticed in my organization that we, through some of those informal type of leaders, we've seen a lot of great innovative ideas that we have taken and ran with that have been really effective.
Yeah, most definitely. And I think that's one of the things that drew me to Geisinger is kind of that innovation mindset. And I think we have that here too. People have really spoken up and stepped up to the plate. It's been really neat to see all the different things going on, and interesting to see my co-fellows and the things that they're working on. Some things that are far and beyond some of the things that I mentioned, and way cooler that some might say. But they're doing great work, and so it's cool to see that.
Yeah. How will some of the things that you've learned through this COVID-19 pandemic in your fellowship, how will that play out in your career? What will you take with you?
I think it's given me a glimpse of how we can do things differently, and a hopeful mindset that we can actually do things quickly in healthcare. We can make a difference today. We don't have to wait for a few years until that happens. And it's helped reinforce some of the leadership principles that I hope to apply throughout my career in terms of making relationships and really help individuals and people. This has been an opportunity where people are fearful and they're upset because their expectations for the last 2 months have gone off the rails. And so anger is the result of unmet expectations, and people are angry, they're fearful. But being able to be a fellow and be a healthcare leader during this time and connect with those people, to listen to them, give them a calm presence, a voice of reason and hope, is really one of the most rewarding things that you can have as a leader and as an individual during something like this. And so really taking that with me and recognizing that human element and the hope that we can get things done quickly and do healthcare right is very meaningful to me during this time.
I love that, Travis. Thank you so much. I think that fellows like you really have a unique perspective on this whole response. And I think that there are absolutely those learnings that are shaping us and shaping the leaders of the future. And I think it's important to reflect on those lessons, those learnings, and important to highlight some of the work that you're doing. So I just really appreciate you hopping on this video with me today. I hope that you stay safe and are able to keep bringing this valuable work moving forward, and just appreciate your time.
Thanks, Audrey. Really appreciate you too. And I think, to your point, these are really insightful questions and great to reflect on. So I appreciate the opportunity for me to reflect on those things and really what I've been learning.
Thank you all for watching. This was COVID Fellows, a short video series where I interview administrative fellows. For more related content, follow me at Audrey L. Workman on Twitter or find me on LinkedIn. Stay safe out there, everyone, and thank you.